Hello everyone! Today we are going to explore an important topic in hematology that you will frequently encounter both in laboratory practice and clinical medicine: erythrocyte sedimentation rate, commonly known as ESR, along with the concept of reticulocyte count. Let us begin by understanding what ESR actually means and why it is so clinically relevant. Erythrocyte Sedimentation Rate, or ESR, is defined as the measurement of the rate at which red blood cells settle down in a vertical tube over a period of 1 hour. Now, you might wonder, why do red blood cells settle at all? This happens because red cells are denser than plasma, so when blood is left undisturbed, they gradually sink to the bottom. The distance they fall within 1 hour is measured in millimeters and gives us the ESR value. This simple test serves as a useful indicator of inflammation and disease activity in the body. Now we will discuss the methods used for measuring ESR and related tests like reticulocyte count. There are several methods to measure ESR. The two most common are the Westergren and Winthrop techniques, each using a vertical tube and time sedimentation. The Westergren method uses anticoagulated blood diluted with saline, placed in a calibrated tube. The fall of red cells is read after 60 minutes in millimeters. The Winthrop method uses a shorter tube and different calibration, which may yield slightly lower values. Laboratories specify which method they use for accuracy. Proper technique matters. The tube must be vertical, temperature controlled, and free from vibration. Small errors can change the ESR results significantly. ESR reflects how red cells aggregate and form stacks called rouleaux, increasing sedimentation. Acute phase proteins like fibrinogen promote this aggregation. Factors such as anemia, pregnancy, age, and certain medications can alter ESR independently of inflammation, so interpretation requires clinical context. Normal ESR ranges vary with age and sex. For example, older adults often have higher baseline ESR values than younger individuals. A markedly elevated ESR suggests active inflammation, infection, autoimmune disease, or malignancy, but it is nonspecific and does not identify the exact cause. A normal ESR does not rule out disease, especially early infections or localized infections. Always correlate ESR with symptoms and other tests. Trend monitoring is valuable. Rising or falling ESR over time helps assess disease progression or response to therapy more than a single isolated result. Compare ESR with other inflammatory markers like C-reactive protein, which can rise and fall more rapidly, offering complementary information. Laboratory reports should note the method used and reference ranges. When in doubt, discuss borderline results with the clinical team for proper interpretation. Now let us shift focus to Reticulocyte Count, another essential hematology test that evaluates bone marrow red cell production. Reticulocytes are immature red blood cells recently released from the bone marrow. They still contain residual RNA visible with special stains. A reticulocyte count is expressed as a percentage of red cells or as an absolute reticulocyte number per microliter, depending on reporting practice. High reticulocyte counts indicate increased marrow response, such as after hemorrhage or hemolysis. Low counts suggest inadequate marrow production or nutrient deficiency. Automated counters can measure reticulocyte percentage and immature reticulocyte fraction. Manual methods use staining and microscopic counting for confirmation. Interpreting reticulocyte results requires correction for anemia severity. The reticulocyte production index adjusts for low hemoglobin to assess true marrow responsiveness. Together, ESR and reticulocyte count provide different insights. ESR signals inflammation, while reticulocytes reflect bone marrow activity and red cell turnover. For example, in suspected autoimmune hemolytic anemia, a high reticulocyte count with an elevated ESR supports active hemolysis with systemic inflammation. In chronic inflammatory diseases, ESR helps monitor disease activity, while reticulocyte count evaluates anemia causes and marrow compensation. Limitations include ESR's non-specific nature and reticulocyte variability with sample timing. Always interpret both tests alongside clinical examination and other labs. Practical tips. Ensure proper sample handling, know your lab's reference ranges and methods, and use serial measurements to follow trends rather than single values. Thank you for your attention. Review the illustrated sedimentation and reticulocyte diagrams, practice interpretation, and consult mentors when results are unclear. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.